Sickle cell disease, or what you may call sickle cell anemia, is a genetic blood disease resulting from the presence of an abnormal form of hemoglobin, call it hemoglobin S, causing the red blood cells to contort into a sickled shape. The signs and symptoms of sickle cell disease can be classified into acute and chronic manifestations. The major acute manifestations of sickle cell disease may include recurrent infection, mainly due to bacteria, anemia due to excessive hemolysis of the sickled cells, acute vaso-occlusive pain. You can have a stroke, acute chest syndrome, bone and myocardial infarctions, not forgetting priapism and venous thromboembolism. The major chronic manifestations of sickle cell disease are related to chronic organ ischemia and infarction. So these might present like chronic pain, chronic anemia, neurologic disorders, or you might call it seizure disorders. You might have pulmonary disorders like pulmonary hypertension, renal impairment, hepatic injury, delayed puberty and growth retardation, not forgetting chronic leg ulcers and proliferative retinopathy. So, when a patient presents with already mentioned signs and symptoms, it's good to do the HB electrophoresis as a confirmatory test in the lab for the diagnosis of sickle cell disease. Individuals with sickle cell disease should be seen regularly by the clinician and treatment team as part of their comprehensive healthcare maintenance program. Firstly, hydroxyurea is the mainstay of treatment for sickle cell disease as it reduces pain and other vaso-occlusive complications. But still, all individuals with sickle cell disease should receive daily folic acid supplementation. Antibiotic prophylaxis should begin from the first 3 months of life up to 5 years of age, but the decision of whether to continue with antibiotic prophylaxis after age of 5 should be taken on a case-by-case basis. The individual can also receive blood transfusion depending on the indication. Now, for example, surgery or pregnancy complications. But age-appropriate vaccinations, including those for Streptococcus pneumoniae, should be received. Still, individuals with sickle cell disease who present with acute pain due to a probable vaso-occlusive crisis should receive adequate hydration as well as pain control using a fast-acting opiate. While the survival for individuals with sickle cell disease is reduced compared with the general population, the prognosis of sickle cell disease has been steadily improving following the institution of comprehensive care.